My name is Tricia Seastrom, and I am the Executive Director with Panacea Services.
All right, so my name is Maria Cardenas. I work with Panacea Services specifically for public health. I was I helped facilitate the curriculum, and in addition to, I was the case manager for the kids once they started the internship process.
Okay, I'm Christine Tien. I'm the program manager for the California Endowment, and I'm in their Sacramento office.
Well, we implemented the program here in Sacramento for the first time as a summer program and opportunity for youth, but I think it's important to note that the program is very flexible and can be implemented as an after-school program during the school year. First component, part one, is an intensive in-class component where the students learn about the basics of public health. And then the second component is an internship working in the field of public health in community-based agencies or public institutions such as we have the Sacramento County Public Health Department to learn about careers in public health. And beyond that, health disparities and health inequities in the communities where our youth live and we work.
I would say really get young people involved and interested in public health, and especially with a particular, I guess, bent towards health equity.
We targeted students 14 to 18 years old who were attending one of the high schools in the BHC community area. Those students were eligible to apply. They had to be currently enrolled. The more challenging concepts of the isms in public health, racism, sexism, oppression, historical racism, and those tougher concepts, and leading to helping them understand the health disparities and inequities.
We worked with kids who were at high risk, those kids that are not making the grades, that are not enrolled in clubs.
Particular criteria for students for this program also included, not just kids 14 to 18, not just young people at the high schools in the BHC area. This program is designed to particularly target youth who are boys and men of color, who may not have had an opportunity such as this before. It's designed to target those youth.
There were a couple of different goals for public health, or our students from public health. One of our main goals was to allow kids to become engaged in school and to understand why getting a high school diploma is so important to kind of prevent some of the oppression and discrimination within the community. Another goal was to allow them to learn about careers in public health, and hopefully this would trigger them to kind of continue on with their higher education. For example, when we first introduced what public health was, we talked about it being preventative and promoting equality within a community.
Health is more than just your individual health. We're looking at it more from a systems point of view, looking at where you live, where you walk. Where you walk to school. All of those things contribute to a person's health.
To have youth learn about careers in public health, learn about the health disparities and inequities in the communities where they live, and learn how they can go out into their community and have positive impacts on those in the arena of public health.
We had a little sticker campaign that said, "This is public health," and there was also one in Spanish that said, "Esto es salud pública." So what we had them do is go around in their community and really identify where public health was. So for example, we had students putting public health on their seatbelts as because public health is within policies and laws. We had students putting stickers on buses or bus routes to prevent, obviously, environmental but also transportation wise. We had students highlight or put their stickers on fire extinguishers, safety. So that was one of the activities. It's important for our area because they really understand that how the environment plays a role in your health, whether it's access to fresh produce, whether it's access to a doctor, a clinic. Obviously, South Sacramento has a clinic that people can go to, but we also talked about the barriers that people face to get there, transportation. Although these clinics are great, you have to sit there for hours in order to be seen, whereas if someone from East Sacramento were to go to the doctor, they usually have insurance and they're seen within 15 minutes of them arriving, whereas someone from South Sacramento has to go in and sit for a while. They may not even have health insurance, so they might prolong their sickness until they can't really do anything. Obviously they try home remedies, and then eventually when they're sick enough, they go to the doctor, and by then it might be really late. I think it's important for our community to understand that although there are resources within South Sacramento, that the resources that are there need to definitely be better than what they are.